Did you know that a single insect bite can change the life of your pet and even your family? Today, we're going to talk about Leishmaniasis, one of the most worrying diseases for public and animal health. What is Leishmaniasis? Leishmaniasis is a disease caused by the protozoan Leishmania spp. It is transmitted mainly by the bite of the sandfly, Leishmania in Brazil and phlebotomys in other regions. It can affect animals, especially dogs, and also humans, and is considered a zoonosis. Scientific data. According to the World Health Organization, WHO, around 1 billion people live in areas at risk for leishmaniasis in more than 98 countries. Types of leishmaniasis. Cutaneous leishmaniasis affects the skin and mucous membranes, causing ulcers that can develop into serious wounds. Visceral leishmaniasis. Cases are more serious. It affects internal organs such as the liver, spleen, and bone marrow. It can be fatal if left untreated. Interesting fact, the term Kala-Azar comes from Hindi and means black fever. How is transmission transmitted? The protozoan is transmitted by the bite of a sandfly, which has previously sucked the blood of an infected animal or human. Dogs are the main reservoirs of the disease, but other animals such as rodents can also host the parasite. Humans can contract the disease, especially in areas with a high concentration of sandflies. Symptoms in dogs and humans. In dogs, weight loss, skin lesions, especially around the eyes, nose, and ears, abnormal nail growth, apathy, and fatigue. In humans, prolonged fever, weight loss, anemia, enlarged liver and spleen. Tip: not all symptoms appear clearly, which can delay diagnosis. Diagnosis is made by blood tests, serology, and PCR to detect the protozoan DNA. In humans, bone marrow or spleen puncture is also used for confirmation. Always consult a veterinarian or medical specialist when you notice signs of the disease. Treatment. In dogs, treatment is carried out with antimonal medications or miltefosine. However, the treatment does not completely eliminate the parasite and the animal can continue to be a source of infection. In humans, medications such as amphotericin B or miltefosine are the most commonly used. Warning: treatment of infected dogs is regulated by the Ministry of Health and the Ministry of Agriculture in Brazil. Consult a veterinarian to understand the protocols. Prevention. Use of collars impregnated with insecticides such as deltamethrin reduces the exposure of dogs to the mosquito. Preventive vaccines are available for dogs, such as leash tech. Environmental control. Keep yards clean and avoid accumulation of weeds and garbage, places where the mosquito proliferates. Use repellents and window screens for humans and animals. Tip: whenever possible, avoid taking your animals out at dawn or dusk, when sandflies are most active. Impact of the disease on public health. In Brazil, leishmaniasis is a notifiable disease, indicating its high impact on public health. Peri-urban and rural areas are the most affected due to the presence of mosquitoes and infected dogs. Control programs involve capturing mosquitoes, tracking infected dogs, and educational campaigns. Leishmaniasis is a serious disease, but with information and prevention, it is possible to protect the ones you love. Talk to your veterinarian, take care of the environment, and share this video so that more people are aware of this reality. Together, we can defeat Leishmaniasis. Subscribe to the Vet News channel and stay up to date with more tips and information for animal welfare.